Good day, class. Our topic for today is specimen collection and laboratory diagnosis for viruses. The video lecture is divided into two. The first part will try to cover the specimen collection, and the second part will try to cover the laboratory diagnosis for viruses. This video lecture is somewhat lengthy, so please bear with me. For the references, please refer to Mahon and Baylis and Scott. For the preparation of your quiz, please refer to Mahon and to this video lecture. So let's start with the specimen collection and processing considerations. So collection depends on specific disease syndromes, viral etiology suspected, and time of the year. These are the three elements that we need to consider pagdating sa collection of sample. Pag ang causative agent naman natin, class, are viruses. So let's start with the base of the disease. Okay, based on disease. Okay, this is somewhat complicated since some viruses enter certain areas, for example, respiratory tract, but yet infect distant tissues and organs and become systemic. Second class is etiologic virus. Okay, this is also somewhat complicated since many similar clinical syndromes may be caused by different viruses. So for example, under respiratory disease viruses, they produce the same clinical symptoms, however different causative agent or different viruses. So for example, influenza, para influenza. Then you have your syncytial virus. Those are different viruses, but they produce the same clinical manifestations. And lastly, class, for the collection consideration is the time of the year because there are some viruses that are only seasonal. Example, influenza. So influenza are more increased during winter and then more decreased cases during summer. So for example, during summer, tapos di ka na magko-consider na hindi to less possible na influenza ang causative agent because the influenza is seasonal. Ayan. Dengue also was seasonal before but now considered not seasonal anymore because we can find in Philippines, we can find dengue cases throughout the year. For the specimen collection and processing class, it is also important to note that the specimen must be collected as early as possible following onset of symptomatic disease. This is somewhat difficult in Philippine settings. Why? Because Filipinos usually don't go to the hospital and get consultation unless they are severe or kung hindi na talaga kaya. But here in Japan, class, so for example, nag-fever ka, first day, they usually go to the hospital agad and then seek for consultation ng doktor. One of the possible reason is that mura lang talaga dito, class, and then covered lahat ng insurance. Kaya Japanese people tend to go to the hospital frequently compared to other countries because of the healthcare system nila. So again, class, so dapat as early as possible following onset of symptomatic disease. Example naman dito, class, is fever. So pag nagkaroon ng fever, they should go to the hospital and then collect sample. And then virus titers are concentration of the virus, usually highest in the early part of the illness. So if you can observe on this picture, class, okay, so ito naman yung viral one-step growth curve. Kung sa bacteria, meron tayong growth curve, sa virus din meron. Naalala yung sa bacteria, class, so you have your lag phase, and then you have your plateau phase, then decline. So pagdating sa viral one-step growth phase naman, class, meron tayong apat din. So you have your absorption, eclipse, synthetic phase, at saka latent period. So, ang kaibahan ng bacterial growth phase at growth curve at saka viral growth curve is that sa virus, hanggang plateau siya, class. Wala siyang decline phase. So, let's start with absorption. So, yung absorption, ito yung initial phase. if you will try to correlate this one during the replication cycle of your virus, dito yung attachment class. Kaya attachment, dito nangyayari sa absorption. Then second class is the eclipse. Eclipse phase is the uncoating step. So usually class, uncoating step lasts for 10 to 12 hours. Ayan, so pag nag-uncoat na yung viruses, nire-release na nila yung genome. Diba naalala with the previous video lecture? So under niyan class, you have your eclipse phase. After na-release na yung genome class, then now pwede ka nang magkaroon ng micromolecule or protein synthesis class. Ayan, so new virus particles are assembled and start 12 hours post-infection. And then after na naman yan class, latent period na where nakalagay dito class, highlight ko class ha, nakalagay dito, no extracellular virus. Ano ibig sabihin class? Lahat ng virus nakapasok na sa loob ng cell. Okay? Can be detected and then max plateau na siya. So, ito yung class kita natin. You have your absorption. Sa absorption, ito yung itsura niya. Okay? Tapos, sa eclipse, kasi yung eclipse, ito yung preparation class. And then, dito na siya mag-increase where all your viruses are inside the cell already. So, viral shedding usually greatest in the early stage of infection, and then sensitivity of viral culture may decrease rapidly 3 days after onset of symptoms. So, that's why class here in our laboratory, since we are a hospital-based, yung ginagawa namin class is that when we receive a sample, we usually ask for the onset of fever. So, kung anong, for example, pag magko-collect ng sample, sa laboratory namin kasi class, hindi kami nagko-collect ng sample. Kami lang yung nagre-receive. So, pag nag-receive kami ng sample, we usually ask the collector, an infectious disease collector naman class, physician, specialist, we usually ask them if kung kailan yung onset ng fever. So, for example, 4 days na yung fever, then doon na nag-collect. So, therefore, the sensitivity of the culture is less. Ayan. So, pag nagkaroon kami ng negative result, then we can actually talk to the physician. This could be probably because of the time of collection. Kasi the longer the time na hindi mo siya na-collect kaagad, the sensitivity of the cell culture is lesser. Ayan guys. Okay? So these are the notes that we need to at least familiarize. Okay, aseptic collection is a must of course. Dapat class. Ito yung pinaka-golden rule natin class. And then, aspirated specimens are preferable. Paki-highlight class, pakilagyan naman ng 1,000 stars. Aspirated specimen is the most preferable sample. And then, kung ano naman class, we can also use swab. Dapat Dacron or rayon can also be used. For to inhibit the replication of some viruses and inhibit nucleic acid amplification test, do not use your calcium alginate swab class. Kaya ito yung isa sa mga dapat nating tandaan pag nag-work na kayo sa laboratory. Bakit? Kasi your calcium alginate swabs are usually common swab na ginagamit sa bacteriology. So, pag hindi mo alam na ginamit mo pala calcium alginate swab, tapos nag-collect ka ng sample, negative yung result, syempre, ibibigay mo yan sa doktor. Tapos yung doktor, wala, bakit kaya nag-negative? Parang viral infection naman to. Ang nangyari, ang problema, ikaw, medtech. Bakit? Kasi anong ginawa mo? Nag-collect ka ng sample, which is tama, mali yung ginamit mo na swab, which is your calcium alginate. Okay, class, tandaan, kung hindi aspirated specimen, pwedeng swab. Yung swab naman, class, Dacron and or rayon. Hindi pwedeng calcium alginate. For tissue samples, must be kept moist by using viral transport media class, VTM, viral transport media. Pwede din saline class, pwede din Triptychate broth. Pero yung usual na ginagamit class sa hospital at sa mga virology laboratory, paki-highlight, viral transport medium. So these are the area of collection for common specimen. So you have your throat, nasopharyngeal swab, in or aspirate. So highlight ko lang din class ha, remind ko na lang din sa inyo that the collection of your sample depends on the manifestation ng pasyente. Diba, nabanggit naman natin noon sa previous video lecture. The same lang naman din yan kasi pagdating sa bacteria at saka mycology. Okay, so it depends on the clinical manifestation. So kung, for example, may ubo, then respiratory secretion yung kukunin mo. Hindi pwedeng skin scraping, hindi pwedeng urine. Bakit? Kasi kung saan yung may symptoms, dun yung highest concentration ng virus mo. Then so you have your throat, nasopharyngeal swab, and aspirate. Then pwede ka rin mag-bronchial and or bronchoalveolar washing. And then pwede din rectal swabs and or stool specimens, urine, skin, and mucous membrane lesion. In addition, class, we can also use blood for plasma for viral load, serum naman class for antibody testing. We can also use sterile blood fluids other than blood. So you have your CSF, synovial fluid, etc. Please refer to your EUBF for the sterile body fluids reference. Then we can also use bone marrow, specifically if you are suspecting that the patient is having a parvo B19, because the parvo B19 usually go to the bone marrow and attack the progeny cell of your red blood cell. And then pwede ding tissue class. Okay, for the virus transport media class or VTM, it consists of your buffered isotonic solution, and then it also contains your albumin. Kung walang albumin class, pwede naman ding gelatin or serum proteins. Okay, the purpose of the albumin, gelatin, or serum protein class is to protect less stable viruses. Sir, itanong ko sir, sino yung mga less stable viruses? Kasi nakalagay naman sir, nakasulat dito sir, less stable viruses. So tanong ko na lang din sir, kano yung mga less stable viruses? Madali lang yung sagot dito class. Less stable viruses, those are viruses that have, tama class, envelope. Okay? That have envelope. Mga viruses na merong envelope, those are less stable viruses compared na mga naked na viruses. Okay, bakit? Sir, bakit? Tanong ko na lang din, sir, kung bakit sila less stable. Because, take note class, kung babalikan natin with the previous lecture, your envelope is composed of lipids, and lipids are easily be destroyed. Usually, pwede ding alcohol, diba, konting ano lang ng alcohol, na destroy kaagad yung envelope. So, sir, kung na-destroy ba yung envelope, non-viable na ba yung virus? Yes, class. Pag pag envelope virus siya, pag natanggal yung envelope niya, class, lahat hindi na siya okay. Kaya therefore, you need to protect the whole virion. Okay? Hindi pwedeng, okay lang naman na matanggal yung envelope kasi andun pa naman si capsid at saka si DNA at saka RNA. No, so you need to protect the whole virion class. Okay? Sir, bakit kailangan talagang i-protect? Remember that the envelope contains what class? Tama, glycoproteins. Okay, the glycoproteins that will bind to the cell or specific cell. Ang tawag dun class, tropism or cell tropism. Diba? Na-discuss natin yan in the previous video lecture. And class, added with antibacterial and antifungal agent. Paki-take note na lang din class, paki-highlight na yung pinaka-common na ginagamit natin na antibacterial is penicillin class, kay penicillin. Naman class, antifungal naman class, ang usual na ginagamit natin dito class, paki-take note, streptomycin. Strepto. Okay? Streptomycin pag antifungal, pag antibacterial naman class, penicillin. So there are samples class na hindi kailangan ng viral transport media. So example ng mga samples that can be collected without the use of viral transport media, ito yung mga sample na liquid form class. Example, blood, bone marrow, CSF, amniotic fluid, urine, pericardial fluid, pleural fluid. Okay? So, majority of the sample have a fluid. Urine, CSF, at saka blood. Okay? Yung mga solid form na mga sample mo, example, respiratory swabs, at saka tissue samples, ito yung mga samples na kailangan mo ng viral transport media. Okay? Pagdating sa questionnaire sa exam, pag tinanong kung sino-sino yung mga hindi kailangan ng viral transport media, isipin mo na lang, class, kung ang sample is liquid or solid. Kung liquid siya, so therefore, hindi na kailangan ng transport media. Tapos, kung ano sa class, solid siya, then therefore, you need to have your transport media. Take note also, class, that the purpose of your viral transport media is to make your sample moist. Okay? The moisture will actually protect the virus. Okay? Kung dry kasi sa class, what will happen? The virus will dry up also and easily be destroyed. So, therefore, you need to have your viral transport media. So, itong mga sample like blood, bone marrow, CSF, in-liquid form siya. So, therefore, meron ng water content ang sample mo. So, meron ng protection. So, it will make your sample moist. Ayan. Example of your transport media naman, class, we have your amis medium, Stewart's, at saka Levofits, Emorifid medium. So, ito yung tatlo yung pinaka usual na ginagamit, class. Pero yung recommended naman, class, you have your Stewart's. Narinig na, diba? Yung Stewart's mo naman, class, kaya narinig na natin to sa bacteriology. Kaya either, pwede naman natin gamitin yung transport media na Stewart's na ginagamit natin sa bacteriology to collect your virus. We also have your Hank Balanced Salt Solution, class, HBSS, pwede ding Eagle, tissue culture media, kung meron ka, and our commercial kit. Then, you can follow the manufacturer specification. So, these are the examples of your virus transport media, class. Or, okay, we usually term that one as VTM. And class, VTM or viral transport media. Okay, so let's move with the types of blood specimen for viral diagnosis. Paka-highlight to, class, kasi importante to. Pag whole blood naman, class, specifically heparinized, ideal for virus isolation. So, if your purpose is to isolate the virus, okay, then you can actually use your whole blood. Okay? Take note, class, ideal for virus isolation. So, yung virus isolation naman, class, take note with this one. Okay, for virus isolation, ginagamit natin is culture media naman, class. Okay, culture media. Culture media, yan. Or, you have your cell line. Okay, plus your cell line, of course. Okay, yung cell line mo kasi hindi yan siya tutubo kung wala kang culture media. Okay, take note with this one, class. Pag virus isolation, pwedeng whole blood, heparinase. Okay, pag plasma naman, class, EDT yung ginagamit natin, class. Pag-highlight, EDT naman yung ginagamit natin for plasma. Ideal for viral load or molecular test. So, kung magpe-perform ka ng PCR, so therefore, you need to use your plasma, class. Okay? Can also be used for serologic testing. Ayan. Alam naman natin to kasi na-discuss nyo na to sa virology. Pwedeng plasma in or serum pagdating sa serologic test. Pero pagdating sa virology, class, paki-take note, molecular test, or viral load naman, class, you have your plasma. Paki-highlight plasma. Next, class, you have your serum, okay, collected in plain tube. Normal clotting naman, class, collected with a clot activator, pwede din, para mas mabilis yung clotting. And then, collected with the clot activator and serum separator, pwede din, class, allowed to clot before centrifuge, and then common sample for serology. So, pag tinanong sa question or sa exam kung anong sample ang gagamitin mo, pag gusto mong mag-PCR or molecular test, pwedeng plasma. Tapos, if kung gusto mo mag-virus isolation using your culture media and cell line, so dapat ang sample mo is whole blood. Pag serology naman, class, pwede kang mag-plasma, pwede ka din mag-serum. Okay, let's move with the viral culture samples. It must be processed immediately. Okay, as in medical technologies, or a virologist, what you need to do is, pag naka-receive ng sample, as much as possible, it should be processed immediately. Pero merong mga cases, class, na hindi talaga natin mapaprocess, diba? So, ano yung mga kailangan natin i-consider? First, for the transport, dapat naka-place siya in ice during the transport. Hindi yung importante, class. Hindi pwedeng by hand. So, dapat siya, ice box talaga siya. And then process within 12 to 24 hours upon receiving. Some viruses such as your respiratory syncytial virus class RSV may be difficult to recover even a few hours of delay. Kaya take note with this one. RSV class is very common in saan ba siya common class? RSV, respiratory syncytial virus, common siya with children. Okay? RSV, somewhat the same with your influenza, but common in children. Okay? So if delayed is expected, sample should be stored at 4 degrees Celsius. Pag frozen naman class, negative 70, not at negative 20. Masyadong mababa ang negative 20. Okay? So this will be if delay will take up to more than 4 days. Ayan, pwede naman class. Pag tingin mo hindi mo kaya, like for example, may 200 samples ka, hindi mo kaya talaga na ma-process lahat, then you can frozen the sample at negative 70. And then take note na lang din class, highlight ko na lang din to class, then you can only tow the sample once. Okay, you can only tow the sample once. Yan class. Pag i-froze mo siya, tapos after ng 4 days, gusto mo nang i-test, then you will tow the sample and then as much as possible once lang. Even twice, class, can actually destroy your virus already. Okay, take note with that one. So for the specimen of viral culture, yun nga sabi ko kanina class, paki-highlight na lang din, process immediately, must be accompanied with a request form pagdating sa laboratory with the patient ID and demographics. Demographics class include age, yan class, age, tapos syempre sex, ayan. Lagay natin yung mga demographics dito class. And source of specimens. So, dapat nakalagay. Okay? Kasi pagdating sa laboratory class, halos sa mga clinical samples, except blood of course, because alam naman natin kung blood siya or not, but other clinical samples have the same appearance. Kaya dapat nakalabel talaga siya kung ano ang source of specimens. Kung CSF ba or urine. Ayun. Next class is clinical history virus suspected. Ito kasi class, as a virologist and medical laboratory scientist, very important sa atin na meron din tayong suspected. For example, pagkita natin sa request, as suspected for influenza. So at least alam natin yung ano yung mga dapat palatandaan natin to identify your influenza. So, pwedeng CPE, I will discuss that one later, your cytopathic effect, and etc. Ayan, guys. Then, date and time of collection. So, if unavailable, you need to call the physician or person carrying the samples. Bakit importante talaga ang date saka time of collection, class? Always remember that the virus are very sensitive and then they are easily destroyed. So, therefore, pag masyadong matagal na yung sample, then the virus is destroyed, what will happen? You will release a result na negative. So, what will happen to the patient? The patient will die. Sinong may kasalanan? Ikaw, medtech. Kaya dapat, yung mga simpleng tawag lang, pwede mo namang itawag na, ay, Doc, anong oras ba kinolek? Kailan ba ito kinolek? Ayan. So, since we are a health-allied team, then we need to reconnect and then connect to the other professionals as a collaboration effort para ma-treat natin yung patient as fast as possible. So for processing of specimen should occur in biosafety cabinet, of course. Okay, so it depends on the level of your agent class kung ano siya. Pero viruses usually BSL 2 naman class. BSL-3 pag meron kang, usually sa amin, BSL-3 yung ginagamit namin for influenza at saka for HIV. BSL-3 lang din yung ginagamit namin class for coronaviruses. And then, could be processed using protective plexiglass or tabletops. Ang plexiglass naman, class, ito. Ito, kita nyo to. Itong plexiglass naman. Or tabletops, pwede din. So, pipetting should be performed behind the shield. Ito. Okay. And then, discard all materials used in an appropriate disinfectant. Then, wear PPE at all times, of course. Ito yung pinaka-basic class. Hindi ka medtech kung hindi ka nag-wear ng PPE. Yan. So, for the last part of the part 1 class, I'll give you attach supplemental video for the collection, transport, and shipment of specimens for Ebola virus testing. This is prepared by your DOH at saka RITM. So that ends our first part of your specimen collection and laboratory diagnosis for viruses. So please watch the procedures and or protocols na ginamit ng RITM so you can actually have an idea kung paano hinahandle, kinokollect, at saka tinatransport yung sample, specifically viruses. So, that's it for the part 1, and then on the second part of our video lecture, we'll discuss the laboratory diagnosis for viruses.